Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
Hello, welcome back to Healing at the Speed of Light, your weekly laser therapy podcast. I'm your host, Dr. Jason Rountree, and today we are going to be doing a low back pain overview. Low back pain is a major issue worldwide, really, and it's just getting worse. Low back pain really can affect about 80% of the population, speaking about the U.S. population in particular. And back in 2006, it was accounting for more than 264 million lost work days in just 1 year. That's about 2 work days for every full-time worker in the country. That's a lot of missed work days. For a lot of us, missing a couple of days of work means missing some pay too. So this is a significant financial issue. And again, those are 2006 numbers. It's been close to 15 years since then, and it's definitely not gotten any better. The total costs of low back pain back there in 2006 was more than $100 billion per year between lost work days and medical care that had to be rendered. And so it's a significant issue. And we're talking about it today in the midst of this coronavirus epidemic for a couple of reasons. One, low back pain has been an issue for a long time, and it's going to continue to be an issue for a long time. But a lot of us are working more from home right now, which means we don't have our regular office setup, and many people haven't necessarily looked at how efficient their setup is from a perspective of ergonomics. Is your back bent? Are you slumped? Do you have your head too far forward? Are you having to look too far down at your computer screen? Are you in a position where you can even, be in that good posture to prevent new problems from cropping up? Well, if you haven't thought about that yet, please do think about it. And if you've got a local chiropractor or physical therapist that you've worked with before, get a hold of them to see if they will do a ergonomics assessment on your home office setup. A lot of them are available to do that over video chat even. That's something you could have done to make sure that you're going to come through this and be in better shape than you otherwise would. But no matter what, a lot more of us now are sitting for all of our work and not always in the best posture. The more you sit, the more likely you are to have low back problems. The more you sit, the more likely you are to gain weight. And if you're obese, your likelihood of encountering lower back problems are much higher. So several layers here. For one, right now, a lot of us are not using correct posture. We're sitting a lot more. We're a lot less active right now, but as a society in general, we're getting less and less active, more and more sedentary. And sitting absolutely leverages more pressure onto the spine than even standing does. So this is a significant issue. There are going to be more cases of low back pain just due to the lockdown we're experiencing right now. There are going to be more cases of low back pain due to home office setups even too. So again, I encourage you to get a hold of somebody that you've worked with before locally in your area there to get them to do an assessment of your home office setup. Make sure that if you can correct some of your ergonomics that you do that. That'll help you get through these kind of trying times, hopefully with less back pain, less spinal injuries, things like that. But back to going over kind of low back pain in general, more than a quarter of adults have experienced low back pain during the past 3 months. It's a big problem. It's frequent for many people. It's something that I have struggled with in the past, not for years now, thankfully, but used to have chronic low-level lower back pain. Thankfully, I was able to get that completely resolved and haven't had back pain now in at least 4 years for myself, thanks to laser therapy. Oh, spoiler alert. Laser therapy is good for low back pain. You probably already were guessing that since we're talking about it here on this podcast, but that's where we're going to be going. First, though, before we get to where kind of the way that laser works for low back pain, I want to talk to you about the current recommendations for low back pain. If you go into your local ER or your family health care provider, your primary health care provider, with a low back pain problem, what are you going to get? Well, The recommendations for care right now are to first try and treat low back pain patients with some education as far as what they're doing that might be injuring the back, what they're doing that might be generating pain, and then also with a home exercise program. Now, you might think, well, okay, yeah, it makes sense to not hurt my back anymore, but how is exercise going to help the pain? Well, exercise doesn't necessarily help the pain right now. What it does is it does help you in the long run. And back pain by nature is episodic, meaning it kind of comes and goes. So if you've experienced low back pain episodes before, you're likely to continue to have some more in the future. So what the recommendations are is to try and get ahead of that right now by getting people to exercise. And here's how I want you to think about the spine and the body in general. All right. So if your torso is a soda can, all right, an empty soda can. One side of that is your spine, and the other side of the soda can is your core muscles, all right? So if that soda can is in really just perfect shape, it doesn't have any dings or dents, it's not bent at all, it takes a lot of pressure to crush that can, right? I mean, you can just about stand on that can, and it'll pretty much support a lot of weight. Well, that's what the spine and the core muscles are like when they're nice, strong core, nice, intact spine. Now, let's say the spine is intact, but the core is weak. It's not doing what it's supposed to. That's like putting a little crease in one side of that soda can. Now, as soon as you crease that soda can, as soon as you put a little bend in there, how strong is that can now? Really weak, right? You can crush it with your hands. That's what happens when the core musculature is weak. All the pressure goes into the spine, so the spine becomes injured, becomes painful. So on the long term, you do need to be able to have very good core strength to keep the back in good shape, and that will help with maintaining spinal health, and that will help with reducing episodes of back pain. That's why it's recommended as first-line interventions. However, most recent studies are saying that 60% of people with low back pain that go into the ER, instead of this, they're going to get an opioid prescription. Well, that's not good, because an opioid isn't going to do anything for your long-term back health. As a matter of fact, opioids in 2019, they're estimating over 47,000 deaths due to opioid overdose. And 40% of those deaths were directly due to prescription opioids. And a lot of those prescriptions start with a prescription for low back pain. So not only are opioids going to be dangerous, they're not even going to do anything for you as far as long-term benefits. Another thing that happens a lot in both family primary care offices and the ER is the prescription of NSAIDs, or non-steroidal anti-inflammatories, like ibuprofen. Now, NSAIDs can help to reduce pain and some inflammation, which is tied to pain, but it's not necessarily a safe intervention. Estimates back from 20 years ago say that over 100,000 patients are hospitalized annually for anti-inflammatory related GI complications, gastrointestinal complications. More than 16,000 deaths annually from those complications. And just in the elderly alone, the medical costs of these adverse gastrointestinal events associated with using NSAIDs, like ibuprofen, it probably exceeds the cost of $4 billion per year. This is a big problem. So, obviously the opioids are not safe. They are not effective on the long run for back pain. Anti-inflammatories have a lot of risk even as well. And if you're not being given, good instructions on how to avoid injury and how to exercise to have good futures, what are you supposed to do? And even if you are given the good instructions on exercise and how to kind of do some good work on the long term to benefit your spine, how does that help you right now? It doesn't. You have to take time to build up strength. How long does it take to get strong and have exercises help the spine? Typically at least 4 weeks, in many cases at least 12 weeks. So what are you supposed to do if you're having back pain now and you need to get control of that? NSAIDs like ibuprofen are not necessarily safe. Opioids are certainly not safe, highly addictive. Some people can be addicted in as little as 3 days, depending on their genetic makeup. So what are you supposed to do? Well, physical therapy can be very beneficial, working the soft tissues. Chiropractic has been shown to be very beneficial as well, especially when you combine it with exercise. But I'm going to talk to you about laser therapy today, because laser therapy has been studied not only as a way to reduce the pain right now, but also to improve tissue regeneration, to improve the health of the tissues that are damaged. So getting a hold of pain levels now and assisting with reducing the likelihood that you're going to have episodes of back pain in the future. We've got studies that say that laser therapy is an effective method for relieving pain and nonspecific chronic low back pain, moderate support for clinical benefits for chronic nonspecific low back pain, which moderate support is actually very good. Spinal fusions have minimal support. You believe that? So, especially when you compare or when you pair laser with other modalities like exercise, you can get results for up to 3 months, at least, of effect. Another study showed that you can get statistically significant improvements in pain severity, in the range of motion, and with overall function of how patients are doing on their day-to-day. And then another study that I have here says that laser therapy has been shown to produce immediate pain reduction, similar to lidocaine injection. Well, lidocaine is a numbing agent, a short-term numbing agent. And laser, this study says laser has been shown to produce immediate pain reduction, very similar to having a lidocaine injection, and actually is superior to radiofrequency treatment or nerve ablation in the immediate and in longer-term low back pain. Laser is actually better than lidocaine injections and nerve ablations. Yes, it absolutely is. So laser therapy is typically not the only thing you need for low back pain. Okay, I'm not trying to tell you that all you have to do is laser therapy and you'll be great for forever. Exercise really is important. It really is critical. Think about that soda can that I mentioned. If that makes sense in your mind, you've got, if you've got a really strong, problem-free soda can, it's very, very strong. If you start to lose some of those components, like you lose your core strength, it's easier to crush that can. So exercise is important, but I've seen hundreds of lower back pain patients that can't exercise because the pain is too severe, or trying to exercise actually increases their pain levels significantly to the point where they just really can't do it. So this is where we really get laser therapy involved to bring the pain levels down, improve the health of the tissues so we can start a good exercise plan. Laser therapy can be good in the immediate and in the long term, but it enables you to do something for yourself to help head off these episodes in the future. Improve your long-term outcomes by letting you get started on an exercise plan that will have benefits down the road. So laser therapy is a really important part of a good care plan for lower back pain. So exercise is important, and when you combine these, they can be really, really good. This study here says laser therapy, in addition to exercise, has been shown to decrease pain, increase lumbar flexion, bending forward, and reduce disability in the long term, more than just exercise alone. That's demonstrated on long-term follow-up as well. So really very effective, very well proven, and important for many people to be able to combine exercise and laser therapy for their overall health in the long term. So let's recap real quick. Low back pain, major problem for the majority of United States American patients. Almost everybody's going to deal with this at some point. We aren't handling it well right now as a healthcare industry. We're still prescribing medications that have been shown to be basically ineffective in the long term. So what should we be doing? Number one, we should evaluate what we're doing on a day-to-day basis that might be actually creating more problems for the spine. We should be sitting less and losing weight, exercising more, Many times, though, that's dependent on getting the pain down, improving the function, and that's where laser therapy really plays a role. So if you are dealing with lower back pain, if you've dealt with it in the past and you're concerned about future episodes, highly encourage you to get to a competent physical therapist or chiropractor who can help you with this and who can also do laser therapy to help assist these tissues in getting healthier and control pain of anything that you're going through right now. Our Laser Therapy Institute clinics are the absolute best at getting you the laser that you need that will be effective, that will help you get into a good long-term care plan to make sure that you're not losing work days and you're not losing family days due to low back pain. If you have questions, if you want some more information, if you want to know what kind of studies I looked at today to pull some of these quotes from, shoot me an email, info@lasertherapyinstitute.org. Send us a message. Let us know what we can do to help you out. Let us know if you need help finding a good practitioner in your local area that can assist you with laser therapy. And we will be talking with you again next week.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.